Well, Riverside was a unique community. The hospital was there to serve the underserved, really. In the turn of the century, Ellen White wanted a health ministry, especially for those who were underserved. And she worked with a donor named Nellie Drouillard, who provided the initial contributions to support the building of some cottages where a health ministry could be realized. They did a lot of hydrotherapy treatments and natural remedies, and it proved to be something successful for those who were considered unfortunate or underserved, because at that time, because of segregation, there were very few places where blacks could go for treatment. And so Riverside became a national landmark, really, for people who came from all over the country for healthcare benefits and services, because it was the only acute care hospital that the church operated at that time. So that was in 1927, the hospital started. The new building that was built was dedicated in 1948, and then another structure under Elder N.G. Simons, when he was administrator, produced in 1972 a new modern 50-bed facility that is still standing to this day. Nashville was a mecca for education. 2 medical schools there, Vanderbilt University Medical Center and then Meharry Medical College, which it was called at the time. A lot of people came to Nashville for services, but they were for education. Fisk University was there. And so health facilities, where blacks could go for treatment were limited. And so Riverside really became a natural choice for people in the Nashville community to get quality health care. A lot of educators from Fisk and Meharry, and of course, Meharry Medical College then developed its hospital. But Riverside was considered a private hospital for blacks in the Nashville community. And back in those days, very much, it had a higher occupancy. So it was very valued by the Nashville community in those days.